Hi, I'm Dr. Mirrafati from Mira Aesthetic. We are covering our series of educational videos on breast implant and breast procedures. So the next topic I'm covering is how many years does a breast lift last? We just covered how many years does a breast implant last, or how many years do I have before I change my implant, or how often do I change my implant? But this is about breast lift. It's a hard question to answer, and people always ask me, depends on the lift. You know, generally, and also if you gain weight or lost weight, that also changes the shape of the breast lift. And also, does the breast lift have breast lift with implant or breast lift without an implant? So those are all different criterias that changes it. Breast lift is done multiple ways. There is basically a crescent lift where you go on top of the areolar complex and lift it up. There's what's called the Benelli lift. People who have lost massive amount of weight loss, they basically go around the areolar and kind of purse it together like so, and they bring it together. We call the Benelli lift. And there's another one called Madame Le Jour lift, where you have the areolar as well as the vertical. And obviously we have the last, which is probably the best lift it is if you're covering weight loss and glandular breast and you want to lift the whole breast tissue up. It would be called a lollipop or inverted T lift, where you have a scar around the areola, straight down and underneath. Now, I think of all of them, the lollipop or inverted T lift lasts the longest, but that also has its own caveat. The way that I was taught when I was doing my training is that you leave the bottom portion of the breast intact. I found out when you do that lift, where we actually lifting up, we keep the superior and inferior pedicle intact and we lifting it, you get what's called bottoming out, and that bottom of the breast sort of falls out. So when I do my lift, I basically keep the medial lateral superior intact. On the bottom, I cut out the whole bottom portion of the breast because I don't want it to bottom out. And it lasts much longer because there's no breast that's going to fall out. But to answer that question, you really have to talk about what lift you need to do and how often you have to change that lift. And also, is it implant dependent or non-implant? Those are all factors that changes the timing of how often should I redo my breast lift. And again, as I mentioned, if you have a massive weight gain or massive weight loss, that can also change it. So in a nutshell, it's a very complicated question. I think is not 10 years or 15 years applied to this rule as the literature sometimes say it. I really think is patient dependent, procedure dependent, and situational dependent, where you can actually answer all that question. Stay well.